Today, we are going to continue to explore the impacts of the federal government's involvement in the city of Minneapolis, city of St. Paul, and the state of Minnesota. Specifically, we'll be talking about healthcare. I'll be joined by my friend Alex Palacios, who works in the public health space, and we're going to talk top to bottom about how the public health apparatus has changed and how the federal government's response to immigration issues in the state of Minnesota has impacted people's access to healthcare. It's an interesting and nuanced conversation that I think you'll enjoy, and you will excuse us if we kiki a little and sip a little bit of tea during the conversation. Sometimes you need just a little bit of humor to help you get through a tough conversation. I hope you enjoy.
How are you today?
I'm doing really well. I'm so happy to see you again. I think you are our most frequent guest on the podcast now.
What an honor and a privilege. Thanks for having me back.
And you were the first guest as well. And every time you're on, it's always like an insightful conversation. Like you tend to go deep, because you're so knowledgeable about the subject matter. And so I'm really excited to see where we go today when we talk about kind of like public health and stuff.
It's going to be an interesting conversation. And, I'm not big on small talk from the moment we met. So yeah, I'm excited to get into it.
So you are working in public health now, and that's what we'll say. And that's kind of like where your knowledge is coming from. It is March 15th, 2026, because some of our conversation might get specific with regards to any policies that are going on, or the people in place, or the actions that the government is or is not taking against our communities.
Indeed.
So a snapshot in this moment of time. It's also a blizzard outside, which is how we were able to put this together so quickly.
Exactly. We're making the elements work for us. Yeah.
Yes. We were both like, well, we're not doing anything else today.
It was either this or crocheting, so I'm glad it's this.
You can totally crochet while we chat if you want to.
Hey, I just might. I have my yarn right there.
So I don't know how far back you want to start. I don't know if it's with the election of Trump or with the ascension of RFK or what have you. But things in the public health world have changed since the last time that you were on the podcast. As a really fascinating intersection, this podcast used to be funded by the Minnesota Department of Health through a grant, and I believe that grant was rescinded, and then people sued, and now they're making those grants again, and but so much time has gone by that maybe they just like the regular appropriations process, like pulled that funding in general. So funding in the public health world is like all over the place. How is it looking from where you are? Because I'm making less money from doing podcasts and TV shows. How's it for you?
Yes. I work for local government, and we're seeing hiring freezes for sure. Of course, for those folks who are here locally in the Twin Cities, there's been a lot of buzz on the news about the potential closure, of HCMC, which is Hennepin County Public Hospital, which boasted of having amazing clinics that supported those core services that were provided. So many of those clinics have now closed. That includes the sleep clinic, some of our elder care, that includes integrative therapies like chiropractic, acupuncture, that kind of thing. So we're seeing that happen in response to some of these cuts, particularly, the extreme rollback of the Medicaid federally. So we're seeing a lot of effects. I personally am not seeing any uh, for myself, but yeah, we are very concerned about where this might lead.
Hmm. I think rightly so. I came on as the executive director of One Voice Mixed Chorus recently, and it's my first like nonprofit executive director position. And I didn't realize how common it is to work with a deficit in the budget. And when you're already
Mm.
working with a deficit, to then lose funding that you were counting on can be very like crippling, like quickly crippling. Um, and I believe typically the most expensive part of running an organization is the personnel. And so you start talking about cutting doctors and nurses and other people, and that really impacts your ability to see people when they come in. And I think the Hennepin County Medical Center is like the only level one trauma facility. Is it in Minnesota? Like in the entire
In
states?
the
They're
entire
like,
state.
yeah, they're like flying people in from
Yeah,
all over the state to this one Hennepin County funded primarily um, medical center. And now we're
yeah,
threatening to close. It sounds like in part because of a change in funding from the federal government from it's maybe like a multiple different sources of funding. So like you lose one grant in my little nonprofit and it's like, ah, but if you lose several grants at the same time, I can see how there'd be a little panic in the public health community over that.
absolutely. And our county commissioners here at Hennepin County have uh, dissolved the board that was overseeing Hennepin Medical Center and taken charge of it. Things aren't looking fantastic at the moment, but we are looking, I shouldn't say we, they are looking for additional funding streams locally to help support the county hospital. We'll see how that goes. That currently sits in the hands of local elected officials who will make that determination. Uh, and
Not to
so
get
there
too
is,
into local tax policy, but I did read that one of the solutions is to convert what was a temporary tax into for something else into a permanent tax for HCMC. But I think that's just like a metro area tax, not a statewide tax. And so I am interested in this idea that we're funding this trauma center that these other people are getting flown into. So at the very least, I hope they're paying something for their services or a little grateful after the fact at the very least. Send a thank you card to your
and
doctor or your hospital administrator.
wouldn't that be wouldn't that be a lovely world to live in? And yes, I encourage that too. Uh, we are Yes, so there are some tax considerations that are being discussed right now. For example, looking at our huge and incredible venues of sport and seeing if we can't redirect some of those taxes as well, which would be in the hands of state reps. Uh, but yes, we are all across the state, excuse me, being impacted by this, and so we all have a stake in it. We all have a role to play in order to maintain our current levels of health here. We have some fantastic healthcare here in Minnesota, but also it's about health equity, which is where uh, where my work has been for the last 10 years. Uh,
Yeah.
Making sure that everyone has access to the best care possible.
And this is so timely to talk
Mhm.
about equity at the intersection of these grants. Because did you see any of those depositions from the Doge employees and how they were deciding or using AI to decide which grants and which populations would or would not be receiving funding from the federal government. Did you catch that, Alex? Did you see that?
I may or may not have seen it, and I believe no, it definitely wasn't my TV. I was seeing red. It definitely was not my TV. It was the rage that I felt in that moment. Here's the thing: when we are talking about funding for any human service, the funding is as important as the humanity. And for people to be so callous, so uh, just disrespectful to the communities that are being served, it really not only makes me personally very angry, but it undermines all of the work that so many have put in, certainly all of the work from the last 10 years that I've put into public health, and really sets back that clock. That has lasting impacts, no matter how long this lasts, whether it ends today or it continues, which is what is likely to happen. It will have lasting impacts, and so uh, that is what we're all trying to be vigilant of, at least around here, and certainly as we're having this conversation.
Yeah, I think anyone who watched those depositions or even the clips, any competent person was aghast at
Mm,
the incompetence on display.
mm,
And in my mind, you know, it really goes to there needs to be accountability. It was wonderful to see those people, at least in the public sphere, get the attention that they deserve. Is what I'll say. But the people who hired them need to be held accountable, and then the people who hired those people need to be held accountable. I'd like to see it run all the way to the top because it was incredibly disruptive,
mm.
and people are literally dying as a result of some of those decisions. So I uh, can't wait to see how it plays out.
Oh
I
boy.
people get what they deserve, is what I will say, and we will all watch together and see what happens. At equity though, just like speaking to equity, because the tea could get spilled. We could we could go for a long time
And you
talking
and
about those
I, we're
people.
good at spilling the tea. We're good at spilling
We
the tea.
are, we
So,
are. Let me
yeah.
turn myself over to equity.
But wait, before we head into equity,
Okay,
I do
one
wanna
more little
ask you,
sip.
do you
One more little sip.
one more one more tiny thing. I do want to ask you, do you really have hope for accountability? Because right now, I think general feeling that I'm seeing with
I do have hope for
folks.
accountability because it is so popular right now.
Mm,
Um, I think politically, politicians really look to see what's popular to get elected.
right.
Even like I'm a Democrat. I would say Minneapolis moderate, national progressive. It's fair.
That's
And, uh, you see that Trump has built a coalition of people who are really interested in some kind of wackadoo policies. Like they've got the whole Project 2025. You look at it, and you're like, none of this makes any sense. But he delivers on it, and I feel as though on the left side, I don't agree with a lot of the policies that are there, but they can be very popular. And I think if politicians run on what's popular, accountability is one of those things that really will drive people out to the ballot box. And so I do, that's what gives me hope there. Just like belief in self interest gives me hope that there will be
mm.
accountability.
And that is a great way to balance human nature with the systems that we're working with. So I appreciate that take. I'm a little less optimistic, but I do agree with you that midterms are right around the corner, and health and healthcare and the wellness, the general wellness of our populace is going to be front of mind. It's going to be front of mind. So I'm hopeful that things will begin to change. Yeah.
Um, okay, that's enough tea. But
Let's go.
obviously, excellent conversation. As far as tea goes, it's like high quality tea, so that's fine.
Primo.
I want to turn to a specific article on um, at the intersection of health equity and public health. It was called "Too Afraid to Leave Home: ICE's Toll on Latino HIV Care," and it was written by Sam Dondelinger and Cameron Oakes, just to give them their props for what they did. And I'll put a link in the description of the video and the podcast episode. And I was fascinated because we're all so busy. Like, ICE came to Minnesota, Operation Metro Surge. That's kind of what prompted the return of bottomless coffee and these more political conversations. And I'm so busy doing my own thing that even as someone who is actively engaged in public health, I wasn't thinking about the downstream, really human consequences of these actions. And so this article that you sent me, I think was really informative, and is really just kind of the beginning of a much larger conversation about the health impacts of ICE's presence in Minnesota, the lingering ones in particular. So, can you tell me a little bit about the article and how it intersected with your work? And then let's go from there.
Yeah, absolutely. So I remember I was listening to your conversation with Ellie and just engrossed in it. And suddenly I see this article pop up. I'd been asked to provide some commentary on how the Operation Metro Surge had impacted HIV care locally. The article was more specifically around Latino communities because there seems to be a higher disparity in that community, of course, right? But really, that disparity is shared across immigrant communities here locally. The, the title is emblematic of this very important conversation. When you have federal agents who, that operation was originally set to attack our Somali American neighbors, right? And then expanded from there. And so when you have immigrant communities too afraid to leave their homes because of the tactics and the poor training of these federal officers, right? Where anybody could be targeted. I mean, we saw on January 7th and on the 21st how two of our neighbors were shot and killed, Renee Good and Alex Preddy, right? And so people were afraid to come out. What does that mean for my work? I work at a clinic and people cannot maintain their health if they're too afraid to come to the clinic, right? We have people who say, yes, I actually really need your support, but I don't want to leave my house. And
I
so
mean, I
that
think we could
means,
take a minute and we could even put it in, I like to say culturally specific terms, but remember here at Bottomless Coffee, we can just keep it real. I think the conversation, at least from my end, was more like, girl, the white people are killing the white people out there. As a brown person, I'm going to stay home.
I mean,
They're out there killing
any of,
American citizens. If I'm undocumented or even naturalized, no, thank you. I will
no,
keep my
thank you.
doors locked and my shades drawn.
Absolutely. Absolutely. And so that had, for me personally, like, I'm not afraid to say it. I am a naturalized citizen, and I was afraid, but I am a citizen after all. And so, my fear was nothing compared to some of the people that we serve.
Yeah.
But yes, you're right. When white people start killing white people, my first thought is, okay, are we in the first throes of a civil war?
Yeah.
Right? And is Minneapolis once again going to be the center of this worldwide movement, because whatever affects the US, it's going to affect the rest of the globe. So, yeah, there was a lot of fear,
Yeah.
and there continues to be, unfortunately.
Oh, okay. I didn't know about that because at this point on March 15th, I think the official word, which is again hard to believe. I don't know I don't know who to believe. I guess someone in a Signal chat. When someone who I know is in a Signal chat tells me that the ice drawdown is real, then I will then I will believe it.
Yes,
Okay.
yes,
Okay,
and
but
that's
the
who we have to
fear is
look
still
to.
there.
The fear is very much still there, and the article centered on uh, HIV care, prevention, treatment, because chronic conditions like HIV, particularly HIV, not only are often moralized but are used as bargaining chips in this political arena, right? And so, but it has real impacts on people. When folks can't get life-saving medications, right, because they're too afraid to even go to the pharmacy,
Yeah.
that's a problem. When folks are too afraid to get preventative care, right? In the arena of HIV, it would be PrEP, it would be uh, pre-exposure prophylaxis, which protects one from the virus, or PEP, which is used in emergencies. Uh, that's a problem. That's a problem, and it affects the entire HIV continuum and the entire healthcare continuum.
Yeah, I think I'm remembering way back. Um, I have oh, spoiler alert. I'm older than I look, and so I was an adult before um, these incredible treatments for HIV were available to people.
Mm.
And so I'm recalling when a friend went to a clinic and was not able to get medication. Um, their account was very low. They'd been on their stuff, but for whatever reason, something in their insurance changed, or um, maybe they aged out of their parents' insurance. That's possible, but they were not able to afford the medication that they needed for their treatment, and that led to like full on crash out, like just devastated. We're at the life and death stakes when we're talking about people living with HIV and whether or not they have access to treatment. Um, and it can be very difficult when you haven't experienced that either yourself or from a friend or an acquaintance or like seen it somewhere to appreciate how acute that devastation is. Because it's like such a sharp failure point in our public health apparatus. Like, we know people need water to live, we know people need food to live. These people need this medication to live. But that's not the way we treat it. And so, to your point, when we're talking about using this medication as a bargaining chip, or using funding for this medication as a bargaining chip, we're bargaining with people's lives, which is vile, in my opinion, and tends to be done on the right. On the right.
I mean, no lies detected there, right? It is a failure of the system, but you're absolutely right. It is uh, mostly manipulated on the right, and uh, it's uh, it won't be long before we see other things. I believe that should not be moralized being moralized. Um, Water shortages and that kind of thing, right? And
Yeah,
so the and and treating people is not just about access to medication, of course, but access goes two ways. It's providing the medication. It's also making sure that folks feel safe, that
yeah,
folks are informed, and that folks have the right support to be able to lead healthy, self-directed lives. Uh, that is an absolute principle of public health, which is interesting to me now, going up the chain to Health and Human Services, and who is directing that now. Um, they RFK seems to have forgotten some of those principles, and so I'm very concerned. And yeah, I think we'll leave that at that. Um,
Okay. Well, we'll leave that there, but let's return to like kind of almost like a specific case study or a day in the life of, let's say, someone Latino living with HIV, as was depicted in the article, because these ice surges could happen in another city. And so people need to be aware of what may happen and how to protect their own health and like what's important for them to do, what's not important for them to do. And I had some pretty basic questions. I've been with Aaron for so long now. I'm like, I don't know what it's like out there in those streets. I don't know. I hear it's
it
tough.
ain't easy. It ain't easy, to say the least. It ain't easy. Yeah.
But again, I'm older, and so it was drilled into me. No pun there. Um, Condom, condom, condom. Why aren't you wear a condom? Why aren't you wearing a condom right now? And it sounds like maybe that messaging has changed over the years.
A
And
little bit.
so I think some concern in the public health space is that people who are undetectable now, and undetectable is untransmissible, they're on their treatment plan, everything's going well, they're going to miss some appointments, um, and that is going to cause their viral load to change. Is that correct?
That is correct.
And
And
they have to come in, right? Because there are like labs that have to get done.
exactly. So I'll use myself as an example. I am
Oh,
a
okay.
person living with HIV. Okay. In order for me to maintain my health, I have to take a medication, and I have to make sure that that medication is not impacting other systems in my body. I have to make sure that my kidneys, my livers are filtering everything properly, and that I'm, other concerns outside of HIV, since the immune system sort of supports everything else,
Yeah.
are also being cared for, right? Um, that means going to the doctor at least twice a year, but oftentimes more for those of us living with HIV. It also means uh, making sure that we're having regular contact with our doctors about, related external health situations. And so, uh, one of the one of the absolute barriers in this moment is how do we get folks tested for how their levels are doing and what impact they're having on the body uh, if they can't come into their clinics.
Yeah. Um, so what do you do? What have you been doing?
So this, I'm going to give a shout out to the Aliveness Project. The article um, centered on their fantastic work, but we're seeing with Aliveness and with other clinics, public and private, folks mobilizing for community healthcare. Oftentimes, when we talk about community health work, we're talking about home visits. So those have been absolutely increased. Medical professionals attending to patients at home wherever they can. Maybe that means a quick blood draw. Um, Maybe that means just a self test that is then uh, reviewed via telehealth. Certainly, telehealth has uh, it spiked recently. Telehealth is very readily available, but we've seen an increase there. And then the question becomes, at least for home visits, how do we do this in a way that is undetectable to potentially interested parties, right? How do we
Mm.
keep those folks safe? Uh, I know for me, showing up at someone's home with a big lanyard that says I'm a government worker, kind of a giveaway, right? And
Yeah.
so
Yeah.
we're trying to also finesse how we do these established medical practices.
That sounds like a plan in development still. Um, yeah.
And it very much
I was like,
is.
what do you do? I think you said at some point over our text you were getting people Ubers. Um, and so, I'm having visions of people like hustling out to their Uber and then like getting down in the car, so no one sees them on the way to their appointment. Um, I'm assuming medical data is not shared with the federal government, so there's no concern about ICE lurking outside of uh, hospitals or what have you, or clinics in the way that they were outside of courtrooms and the like, where the information was more public. Um, but having to
Well,
like, oh,
because of the repeal of the sensitive locations protections that occurred back in 2025, as soon as the inauguration happened, that really actually gave ICE the ability to sort of go into these sensitive locations. That means hospitals, that means clinics, that means churches. And so there is still a concern whether or not, right? Uh, we know that we have HIPAA protections. Those are the protections that every American enjoys. Every person who accesses the medical system enjoys. That means that their medical information is protected. But we don't know what tactics are being used whenever federal officials do come into spaces, uh, and what the accountability looks like. Would in an instance, would somebody push into um, to a private space? We saw not that long ago medical residents in the University of Minnesota and HCMC do these unity breaks, right, where they were protesting some of these tactics by federal agents. They were questioning staff, they were questioning patients who were being seen. Um, Whoever wasn't behind a locked door, essentially.
wow.
And so there is a very real concern. So there was a moment in time where my colleagues and I were calling all of our uh, patients who were of immigrant populations, despite citizenship or not. We obviously don't have that information, nor do we care. Um, but we were calling folks and saying, "Hey, this is happening. What we've been able to do for you is get you an Uber." And maybe that scene that you described. I haven't seen it happen. I wouldn't be surprised if it did. If people are just sort of coiled in a little bit.
Yeah.
Um, but even providing Uber rides, which I think is a difference that's really making a difference. I think folks are still very much scared to say yes to that option because they don't know if their information will be protected.
Um, you say you haven't seen that happen back in the Uber rides. It reminded me, I used to live in Atlanta and we would drive down to Florida just to go to the beach for like a weekend. And on the way down, we'd cut through Alabama and you'd start seeing these like Confederate flags or whatever. And they just be people in the front be like, Jerome, get down. I'm like, no problem. Sure.
That's
I mean, you know what I mean? Like, and it's lovely to live up in Minnesota where I'm not worried about that anymore. But
mm,
I
mm.
certainly empathize with those people who are having, maybe for the first time in their lives, having to take these kind of ridiculous actions to protect themselves from racism and racist policies, or at least, at the very least, xenophobic um, and
Absolutely.
dumb.
Let's call a spade a spade. This
You know
is
what I mean?
dumb. It is dumb, but dumb
Because it's the
things have
same
occurred.
bros. It's like the same bros from that deposition who are, but they'll look the same, but they'll be a little bit different. Calling the shots in a different department of the federal government, maybe throwing ideas into AI and seeing what sounds good to them, and then implementing
Mm.
them, and all of us being like, "What are you doing? why why is this really dumb thing happening here?"
this is not the time to get experimental, particularly when the outcomes are
Yes.
widely documented. Are
Yes.
widely documented. And if it were just a dumb thing, Jerome, I I might push back a little, maybe kiki a little bit about it, laugh a little, but it's not just dumb. It's neglectful. It's dangerous. And you're right. People will be affected, including by losing their lives if we don't turn this around.
Yeah.
So it's yes, it's incredibly dumb, but it's also neglectful and frankly illegal.
It's I totally agree. I expected it to have I was like, Alex is coming on the podcast. It's gonna be a fun, easy conversation. I had my fun coffee slut mug.
Yes,
But I keep drinking it like
yes.
this now because I'm like, oh, we're serious. I need to turn this thing to the side.
I don't know if you can tell, but because of my lived and professional experience, I'm quite passionate about this. And there, I think, I just think uh, that a call to action is important, and I know you
Yeah.
do as well. Um,
Well,
but
we
yes, yes, I guess I'm not my usual lighthearted
it's
self.
okay. It's okay. We have our little moments, and we had that tea in the beginning. But we have specifically been honing in on the subject of that article, which is Latinos with living with HIV. We can just take those same impacts, the same way those people have been affected, and just like let's take a step back. So what if it's like Latino women, Latin women who are pregnant? What what are they missing? What appointments are they missing? Because that's way more than one or two appointments a year. You know what I mean? Like,
Absolutely,
and
absolutely.
what
So we're
impacts are we going to be seeing downstream um, from these missed appointments? What about the little babies? How
what
often are those babies
about
supposed to be
the
going into the doctor? I don't know, but I know it's a lot.
yes, it
Yeah.
is a lot. Yes, it's a
Who's
lot.
buying them
It's
Ubers?
regular. And we have to believe, right? Because none of these interventions are particularly novel, right? They've
Hmm.
been used in other places and in other times, and we have to believe that folks are stepping up to do the same thing that my colleagues work in my workplace and across the Twin Cities are doing. But we have no guarantee of that, particularly in states like Florida, which are seeing those specific HIV medications being rescinded across the country. We're seeing $600 million in CDC funding, right, being lost. And so, what does that mean for that Latino woman? That means that she may not have access to insurance anymore. That also means that with such a chaotic and dangerous environment, she may not feel comfortable leaving her home. That means missed OBGYN appointments to make sure that she is as healthy as her baby, uh, screenings, right, to see if there are, any genetic uh, considerations in that pregnancy. That means women who are pregnant and living with HIV can bring a child to term if they are on their medications, and that child will not be impacted by that virus. And so now we're
Mm.
rolling that back. And then, if, by the way, in the state of Minnesota, it's been years since we've seen that transmission from mother to child because we've done such a good job at taking care of pregnant moms. Uh, and so, we could see that number escalate after so many years. And then, what about that baby? What happens if that baby, you know, is malnourished? There is a transmission. There are genetic considerations. What happens then? That requires more care than the frequent visits from a healthy baby. And that baby, that healthy baby, is going to see their provider quite frequently. Uh, it is no wonder that folks are not only scared about their health, but demoralized.
Yeah.
Um, and so we like this is this has the potential to impact not just us but generations to come, and that is not hyperbole. That is science.
Completely agree. And as you were speaking, I'm struck by thinking, yo, wow, this is what the conversations at the highest levels of the government should be. There should be people there who are thinking about, well, if we do this, then these are the next 6, 7, 10 steps or symptoms that we'll see, that the consequences to our actions. And from just the little peek behind the curtain that we've had access to, it is clear those conversations are not happening. Um, Different conversations, much shorter conversations, are happening, and those are unacceptable given the consequences.
Unacceptable.
And I think I don't know if other people just have lower standards for healthcare or what. Like, you got people who are like, oh yeah, I broke my bone, and I'm just gonna like pop it back into place or something. I don't know
Oof.
if that's how they want to live or what. I'm not about that life. I'm going to the
No,
doctor.
I need pain management, please and thank you. Yes.
Well, I need easy access to the doctor. Like if I something happens to me, I go to the doctor. I'm supposed to like wait 8 hours with like my bone hanging out of my body or something because we don't have enough physicians. We don't have enough nurses. Like it doesn't compute. When I see the obvious consequences to these funding cuts and these policy changes and these disruptions in life in general, but healthcare specifically, it doesn't make any sense. It's just a bad idea. And
And
so I
and
find
by the
it
way,
frustrating. Yeah, go ahead.
you would be experiencing that in the best of times, right? Before all of these rollbacks, because the healthcare system is an imperfect system. Uh, we have been talking about universal healthcare for how long? We have been trying to account for that not happening for how long? And so, yeah, you may be in a waiting room for a long time, even before these cuts. Rural health is really suffering right now. We've seen
Mm.
clinics close down in rural areas, not just in the state of Minnesota, but across the country. So, yes, to your point, in the best of times, you could be experiencing that. It absolutely doesn't make sense to roll that back.
You're reminding me of my age. And the era when people would, and I guess it still happens, maybe not as frequently, but when medical debt would just like completely
Mm.
wipe you out. And again, from that perspective of a nonprofit executive, I know how frequently you don't want to charge people for your services. You just want accessibility. Like, you know, Martha broke her leg. It cost me $20,000 to fix it. I'm only going to charge her, let's say 15. Martha gets the bill. And it's like, what do you mean $15,000? I'm like, girl, that's a break. That's on the family plan.
Okay, that's the T. That's the T.
But then when you have even less money coming in, it's like, okay, I can't give the family plan anymore. I got to pay full price, and not just full price. I have to raise the price on everybody. And so now we've just got more and more Marthas who can't make their mortgages, who can't go out to eat. The economic impact on the restaurants has been really severe as well. And it's
Mhm.
just it's a whole parade of horribles. I think is the phrase that comes to mind. Everything the eye can see is terrible. and it comes back to these just like poorly considered decisions.
So let's be specific about that, because
Sure.
oh gosh, is that ever the feeling, right? Is that ever the feeling that, as you say, as far as I can see, ugh. And and before I pivot, I want to bring another consideration into this, which is the war that we're seeing now being launched in the Middle East yet again. We're seeing our dependence on oil really hitting us, and that will have reverberations not only in the healthcare system, but across industries in our country and around the world. So that's something to keep an eye on as well. But it isn't all terrible. After all, we may not have a loud and persistent advocate in RFK, but there are good people in the healthcare system
Hmm.
who are marching, who are joining folks in sub-zero degree temperatures to say this is unconstitutional, who are getting creative about how we provide care, who are participating in local government conversations, but are also providing spaces for peer support. That is irreplaceable. It is a bulwark that um, I think has the potential to not only reverse some of the impacts of these very harmful decisions, but keep us afloat until we can see real change in a more progressive, inclusive, uh, legal, and community oriented direction. Um, none of us are spared. Republicans, Democrats, everything in between and outside. We all have our health and wellness to take care of. And we all have the health and wellness of our families to watch out for. So none of us are spared, um, with the exception of, those folks who may be able to pay for medical services right out of pocket. And that is a very small percentage of Americans. So I think we all have a stake in not only continuing to advocate, but in seeing the beautiful things that are happening even now.
That's true. That's true. Um, Even in what we've talked about in this conversation, there are a lot of bright spots that I did not see. I did not immediately see without looking for them. Um, let's take HCMC, Hennepin County Medical Center, level one trauma, people flying in from the state to get the service they need. The doctors and orderlies and nurses are not asking to who they voted for before providing care. Could they? If I'm paying for it, should they be? But that's not how we want them to be. We want them to provide the care that people need, even to people who seem to vote against it at the time, who don't want it until they need it. You know, so be
Do
it.
you know?
So be it. There are also people who braved um, ICE in the streets and the possibility of detention and deportation in order to get to the hospital, to the clinics, to help people in need, knowing that they needed it. And those community networks that you mentioned um, have just been a shining example of the best of, I want to say specifically Minnesota. And I know we've got an issue with Minnesota exceptionalism here in the state. But this is not where ISIS first surge happened.
No.
It's not. But the organization that Minnesotans put together, possibly because of all of the previous traumas, the incredibly rapid and effective response was top notch.
Incredibly.
Top notch.
And let's be real about this, right? You don't need past trauma to prepare for what's coming next. We didn't have to go through what we went through with the murder of George Floyd. We didn't have to, right? Like, these are human systems, and what they require is sustainability and humanity. Uh,
Yeah.
and we're really seeing the humanity in people who are not just being creative about providing healthcare, but delivering food to homebound families and being advocates out in the streets. I am so proud, and I think that the Twin Cities deserve their nomination for a Nobel Peace Prize. I think degree by negative degree did this community earn that nomination, and I just don't want us to forget, right? Because there is uh, this very human, this very real thing about sometimes seeing things improve and taking a step back, and sort of forgetting our history and what we've been through. By the way, this isn't the first time that we've been in this situation uh, in the United States where awful policies were affecting everyone, but they were always reversed. And standing up for what we believe in, practicing joy,
Mm.
um, those are going to be the things that are going to get us through this.
I agree with you. I agree with you. We deserve to pat ourselves on the back, and I think from your mention of trauma, it makes me think about just individual trauma responses and what they can look like. And we did not collapse. We did not cower. We did not comply, as so many people seem to suggest we should.
Mm,
We were incredibly resilient, and post the murder of George Floyd, I had questions over time about whether or not the trauma was being resolved, whether or not healing was really taking place. But um, as this stress test has been put
mm,
upon us, it is very clear that we have not moved on from the incident, but we are prepared communally. We are prepared for that resilience, at least in terms of resilience. And I think we're committed to not wanting to see it happen again. I think that's the whole point of the networks. Um, we witness injustice at the hands of the state, and we were like, okay, well, no.
and
how,
yet
how about
again,
that? How
now,
about no?
Minnesota clapped back. Okay, we have
So
clapped
it would
back.
seem. So it would
Yes,
seem. I mean, I would say it's difficult not to be proud to be a Minnesotan, especially in these times, wherein the pride was a little absent a few years ago.
absolutely. Absolutely. I think it is redeeming. I think it is encouraging and energizing. And I think, this article specifically deals with the impact of racism, right, on
Mm,
our healthcare system. In this case, specifically those folks living with HIV. Um, I think it's really easy to see, issues around race as uh, us and them, right? Those folks are dealing with that, and we're not. And those folks feel that way from one side or the other, and we don't. But when it comes to health, health is such a universal, uh, experience, right? We all have to make, and so we're really seeing not just local communities, but pockets of communities around the state and the country rising up in a way that they didn't 5 years
yeah.
ago, 6 years ago, And so, um, but race is very much a part of this conversation as well. So, my hope is that we will continue to see equalizing humanity and stand up for that. And not just for humanity, but I got to tell you, the way that I get through a lot of this is Jon Stewart gets me through a lot of this.
Okay.
And
Okay.
he is the master at, you know, leveling humor with like talking about the Constitution. Goodness sakes. Some of the folks that we're seeing making these decisions are claimed to be the party upholding the Constitution, and we're seeing a lot of
Are
action
they still claiming
outside.
that? I don't think they are. Are they?
They are still claiming. They are still claiming that. They're still
Have they
claiming
read
that.
it?
They're still. But they all carry it in their pockets.
What did the AI
Okay.
tell them the Constitution says? I think they might have got a hallucination out of that one, out of that prompt. They need to circle back.
Absolutely. And there's no point in carrying your copy in your pocket if you don't open it. Just like there's no point in carrying your insurance card if you can't go to the doctor. So that's my
The accuracy.
mm.
Well, on that accurate note, this has been a beautiful, beautiful catch up and conversation. It was a lot of good content and just a little bit of kiki.
A little bit of
Just a little
kiki.
bit.
You know, again,
the people need it.
Joy is a tool. Joy is a tool. Joy is a tool, people. If you're out there and you're listening, find your joy. That's sustaining. And Jerome, thanks again for having me again. It's always really good to see you. You know, I think the world of you, and I've been enjoying this sort of new iteration of the podcast so much. All of these conversations have been really fantastic. I hope that you continue to be well and that the podcast continues as well.
Well, it seems to be the easiest way for me to see you, so why don't we just keep on sticking with it?
You may have a point. You may have a point.
Thank you, Al.